The one-day conference, which was under the theme Facing the Fact for UHC, Can Research Drive Policy from Innovation in Health Financing and Delivery in Ghana, explored ways of leveraging technology to improve healthcare delivery in Ghana by bridging the gap between research, policy formulation, and implementation. Speaking at the conference, the Minister of Health, Kweku Agyeman Manu, stressed that government remains committed towards attaining universal health coverage for 80% of the country's population by year 2030.
The overall UHC goal for Ghana is to attain at least 80% coverage of Ghanaians having access to essential health services. And to realize this, the Ministry of Health is aiming at these broad targets. Attain 100% health insurance coverage for primary level services. Reduce maternal mortality ratio by 2/3 over what we had in 2017.
Speaking to Joy News on the sidelines, the Chief Executive Officer of the National Health Insurance Authority, Dr. Okoboy, noted that outcomes of the symposium will help the NHIA in formulating effective policies to expand its current coverage rate from 50% to 70%.
About 95% of all disease conditions reported in Ghana are covered by the National Health Insurance. And beyond the 95%, we also stated about 50% of Ghana's population is as we speak currently, is covered or is active on the National Health Insurance. We are working hard to get about 75% by the end of the year. Generally, we are trying to, Ghana, they say that we have so much documents at, I don't want to mention some organizations, but when you go to the ground, little modern technique is being applied. It's because the researcher is in his office, the policymaker is also in his office. So it's work in progress. We are trying to get closer to each other so that we can do better at our work.
In a bid to fast-track the attainment of UHC, speakers and participants at the conference stressed on the importance of building capacity for young researchers to help guide policy formulation in innovative healthcare financing. Speaking to the press, the operations manager for Farm Access Foundation, Dr. Gifty Sonkwa Mills, explained that effective implementation of research findings would go a long way to fast-track the attainment of the UHC.
We have realized that it is important not only to conduct research, but to link the researchers to the policymakers and important stakeholders to ensure that the research findings are actually implemented. Because, as I said, we have done research in so many areas, how to improve healthcare delivery towards attaining universal health coverage, health financing, how to make sure we improve the quality of healthcare delivery, how we ensure that everybody has access to healthcare without catastrophic expenditure.
For Joy News, my name is Carlos Caloni.